Hey, you made the webinar. This is Dr. Visentin. My patients call me Dr. V. I'll give you the number one secret to ending back pain forever. I just had a wonderful meal with my wife. I'm a doctor of chiropractic from East Denver. I have some great information you won't get anywhere else, I promise. And I'm grateful to have you all here. The response has been incredible. I didn't expect people from Australia to check us out on this webinar. This is our first live webinar, and I'm delighted to have you all here. I'm kind of overwhelmed by it and delighted all at the same time. And there's people from England and people from Australia who've signed up and are in attendance, and I want to welcome you all. We're located in East Denver, by the way. And I have some great information for you won't get anywhere else. I'll deliver the goods today. My name is Dr. Visentin. My patients call me Dr. V. And I want to give you the biggest mistakes today. Things that might be holding you back. I'll let you know what they are. The biggest mistakes people make when treating lower back pain, because it's easy to get well. I'll let you know if you stop doing the wrong things, it turns out. And some of you have been told the wrong things. It's not your fault. I'll give you some wonderful ways to save money, thousands and thousands of dollars on treating your lower back, some things you could do at home, some easy things to do, some low-tech, low-cost ways to eradicate lower back pain. By the way, are you still doing straight leg raises? Did you know that straight leg raises in most instances are probably the worst thing you could do for your back if you have severe lower back pain? That's really, really, really bad. And some of the things you've been taught by your medical doctor to do, by your physical therapist to do, are absolutely wrong. If you're still taking Advil, for example, are you still taking Advil and ibuprofen and thinking those things will help you get better? There's better ways to care for your back. And those medications, you'll find out, actually slow down healing. So I have some counterintuitive things to share with you today that are powerful. You might assume that because something feels good, that it's good for you. And I'll mention some of the ways that are actually slowing down healing. You could be doing the exact wrong thing to help yourself. And just one little tip could make all the difference. So get out a piece of paper and something to write with, or a device, and take notes. I'm going to give you a minute to do this. So please go ahead and get out a piece of paper and something to write with so that you can take notes. Get up now. Now's a good time to do it. I've been in practice for over 30 years. I've helped thousands and thousands of people without drugs and without surgery. And I'll let you know who gets well and who doesn't today. That's another little secret I'll be sharing with you. So you could do the things that successful people do to get well. And I'll invite some of you, obviously I can't accommodate all of you, to a special event at my center toward the end, and for some examination without obligation, an evaluation without obligation, so that you could get yourself checked out. And I'll describe who may qualify for that program, because we run a very busy center, and I hope you're getting a pen or a pencil and something to write on right now, because I have some valuable information. And regardless how long you've had the back pain, how badly you've been hurt, whether you've had surgery or not, these ideas work and they help relieve back pain. And I'll mention today the key. Do you know what the key is? It's establishing balance. Does this sound like a logical thing that you'd want to do? You want to establish balance in your life, because balance is the key to life and health. You've heard it said numerous times, no doubt, that balance is the key, and I'll help you achieve balance in your life. And it's not by doing things that are on the internet, by the way. That a lot of the information on the internet is absolutely wrong, and I'll mention the ideas that are holding you back today and give you some new information so that you can do better, so that you can heal yourself. Even if you're sick and tired, feeling sick and tired, and maybe you're a little angry, and maybe you're frustrated, and you've been everywhere else, and you tried everything else, and you're rather skeptical now. I have a program that works for you, and you can move ahead. Don't give up on yourself. I'll mention that most of all. I've helped thousands and thousands of people, and it's a very simple principle that my clinic works with. The principle is this, that the power that made the body is the power that heals the body. Does that make sense? The power that made the body is the power that heals the body. In fact, it happens no other way. My oldest patient, for example, is 101 years of age. She's a wonderful lady, and she's getting results. So if she can do it, you can do it. And what she understands and what she knows that you don't know is that the power that made us is the power that heals us. And then if you establish balance inside of yourself, you're going to do better. Regardless whether you've had surgery and the surgery failed, regardless where you've been, regardless what tests you've had done, in almost every instance you're going to do better. And I'll mention why people don't get well. There's a small number of people who remain the same or even get worse. And I'll give you a little secret that doctors are very aware of. The ones that don't get well, I'll mention who they are and what you could do to avoid what they do. You can always do better. So listen, take notes, use these special techniques. There's some big mistakes you might be making, and if you stop doing them, you could get back to golfing, to tennis, to doing the things you like to do, to chopping wood, to riding your motorcycle, to golfing. If you want to get back to golf, golfers are excited about my program in particular, but you got to stop doing the wrong things so that you can progress. For example, heating pads are just about the worst thing you could do for your back. And you may have been told by a so-called expert to use a heating pad. And putting electrical currents near your body's usually not a good idea. And heating pads pull fluids deep in the joints of the spine and make matters worse. Slow down healing. Gobbling anti-inflammatories as well. Advil, ibuprofen in particular. If you were told by someone on television that this was a good idea, that is not a good idea. That actually slows down healing. And if you've been prescribed these medications, don't get off your meds, but confront your medical doctor and say, hey, why'd you put me on this stuff? You know it slows down healing. I'm not getting anywhere like this. Scientists and doctors now know that Advil, ibuprofen, anti-inflammatories actually slow down healing. You don't want to take those things. You could do better just by not doing the wrong things. And if you've been to every specialist, neurologist, orthopedist, and you've had thousands and thousands of dollars worth of tests done, and you've been prescribed a protruding disc, I think one of the worst things you could do is just wait. Doctors sometimes say things like, oh, we're going to monitor it. We'll monitor your condition. And what they really mean is, we're going to wait till you need surgery, and then we're going to chop on you. And I think that that's horrible, because in about half the cases, people do worse. And then they'll go in and they'll chop again, and the odds of getting well then are even worse. And your odds get worse with each surgery. So if you're out there and you're listening and you've had multiple surgeries on your lower back, you better take notes today. I have some powerful, life-changing information for you. And I love those cases, by the way. I love skeptical people, and you'll find out why I love them and why I really love helping people who've had chronic pain for years get rid of it. They get really excited then, and I get excited for them. So listen very carefully. There's some dangerous thinking as well. I think guys are particularly guilty of this, and I want you to stop this. If you find yourself saying, well, I have back pain, but it's normal for me. I've got the normal back pain. That is crazy thinking. There's nothing normal about having back pain. But guys say that all the time. People come to me all the time after having used heating pads, and that's the worst thing you could do. Using ibuprofen, Advil, they use all the home remedies. They're laying in bed, they're staying in bed, they're assuming that that's a good idea. And bed rest is a terrible idea in most instances of lower back pain. Were you told to rest by some doctor or therapist? and rest in bed, and you've been resting in bed and waiting to get well, that's terrible. These are old-fashioned remedies that actually slow down healing, that make matters worse. And I want you to stop doing that. And if you've been told, well, we're going to monitor your condition, then what that really means is they're going to wait, and they're sharpening their knives right now to open you up, to rip out pieces of your back. And you're not going to be any healthier after they rip pieces of your back out. There's no spare parts in the human body. So obviously these are ways that people make matters worse. It's not your fault. There's a lot of bad information, useless information out there from physical therapists and ordinary doctors. And you may have been told that you need surgery, and I want you to postpone that if at all possible. And I'll show you how to do that. I'm very concerned. I think it's tragic in a way. A lot of the information out there, I think it's absolutely tragic that people just assume that there's nothing that can be done. And they've had a bunch of tests done, and they say, well, you got a slip disc, and they really don't tell you what to do about it. And I think that that's terrible. There's a lot that you can and should be doing. So please listen carefully, take some notes. Even one little tip could make a huge difference in your life. And I want you to start doing some things to help yourself at home. And I'm a different kind of doctor. And some of you are looking at this screen right now and thinking, well, that's very nice for him to say that the body has self-healing qualities, that you could establish balance and do better. I bet he's never had the back pain I have. And just because I'm a doctor doesn't mean I haven't had back pain. I have had back pain just like you probably. I've had back pain so bad it's immobilized me. I've had back pain so bad I had to crawl on my hands and knees on the floor. So I have some idea of what you might be going through. I have, and it gets very negative, and it gets very negative very quickly. And you start thinking all kinds of things. You think, well, I'll never get back to doing the things I love to do. I can't even do my work. Heck, how can I provide for my family? And it gets very dark really fast. And you imagine all kinds of things. And I guess most of all, the reason why I'm saying all this is I don't want you to give up. In fact, I want you to do quite the opposite. Come with me now, and let's do a little exercise together. Let's do a little visualization. This is something you can do to help yourself, to change things inside your body. You could do visualization, and visualization works. And you could close your eyes. You could decide to close your eyes right now. Please go ahead and close your eyes just for a second. And come with me on a journey, because it's a new day. Close your eyes. It's a new day, sometime in the future. And you imagine yourself, you're waking up and you're pain-free. You had your best night's sleep and you feel absolutely energized. And your body's just filled with light and health. Go ahead and open your eyes. So just want to change things up and get you imagining something better for you, because some of you have had back pain so long you identify with it and you think it's normal for you. I don't think that that's ever normal. Having pain of any kind is never normal. And I want you to check out a better way. I've helped thousands and thousands of people over the last 3 decades achieve wonderful levels of health, higher levels of health, and regardless how long you've had the problem, if you're willing to move ahead. And that's the key. If you're willing to make a move to help yourself, if you don't give up, if you start taking some right action and stop doing the wrong things, you're going to do better. You're that well created. You're well designed. And some of you are still rather skeptical and wondering if this is going to work for you. Will this program work for me, Dr. Visentin? You want to know. And you think, well, it sounds good, but you've been through medication and physical therapy, injections and surgery, and you're very skeptical now, and you're gun shy, and I don't blame you one bit. And you're thinking, well, sure, the body can heal itself, of course, but those processes are limited. Maybe you're thinking that. And I want to let you know that great systems are at work trying to heal you. And if you take steps in the right direction, you could do a lot better. If you start getting proper care for your back, then you're going to do better. You're not exempt from natural law. I'll suggest that there are natural laws inside of you and systems inside of you, healing systems that you could access and do better. And I've seen it even in the worst cases. You might not even have a supportive spouse or a good friend that understands what you've been going through. And some of you are thinking, well, heck, establish balance and let the body do the healing. That sounds oversimplistic. Could it be that simple? And I want to suggest that it is, that it's very simple. You could do better and gain back your health, but you're going to have to do something. You're going to have to make a move. You're going to have to make some changes for the better. A program that works, that addresses the pain naturally, is one that restores the inner balance. And you could do that by using heat or ice. Do you know when to use heat and when to use ice? And people ask me this all the time. You should use ice early on, when the pain is sharp, when the pain is shooting, when the pain people describe as nummy or tingly or radiates down the leg. That's a good time to use ice. And use ice using a towel, maybe a wet towel between you and the ice, so you don't burn your skin, because with ice you could burn your skin. And I want you to take notes about this and use the ice 5 to 20 minutes at least 3 times a day early on. And does your back feel stiff or achy? Don't use a heating pad. If your back is stiff or achy, use hot, moist heat. You could use hot, moist heat and get results with that too. Again, don't burn yourself, obviously. Be careful with that. Don't fall asleep on the heat. Maybe put the heat on your back in the form of a compress of some kind. And if you need help, by the way, you can give me a call. I'll give a number toward the end of the program. We've had a fabulous turnout for this webinar. I've got great information for you. And if you're serious about finding out what's wrong and maybe doing something about your back, give me a call. I'll give you that number later on. But use ice early on. And later on, when your joints are stiff, use hot, moist heat. I want to let you know healing's always an inside job. Does that make sense? That inside you have powerful healing chemicals that rival any pharmacy, that you're that well created. And you release these substances naturally when you're in good alignment. I'm Dr. Visentin. We could turn your power on, but you've got to be available most of all and not give up on yourself, regardless how long you've had the problem. I think the worst thing in the world is to give up on yourself. And you might be doing some things that aggravate your lower back at home. Are you sitting around? Sitting around is just terrible. Just take frequent breaks, especially if you're at the computer. Give a cough right now. Give a big cough right now. And does that hurt your back? If you cough and it hurts your back, you might want to take a cough suppressant, or you might want to take a natural laxative so that you don't strain your back at the stool. Straining at the stool can aggravate back problems. Coughing can aggravate back problems. Certain sports right now that involve bending and twisting, like golfing, like bowling, might be out initially. You might have to limit those things early on, or even vacuuming at home. And there's some exercises you could do. Are you still doing straight leg raises, by the way? Were you trained by a physical therapist that straight leg raises are a good thing to do? We got some body work ahead. There is a better way to better health, but straight leg raises for most people are just the worst thing to do. For most cases of lower back pain. Are you doing some visualization? Visualization can be very helpful. In other words, before you go to sleep at night or before you get out of the bed in the morning, you see yourself well, you see yourself happy, you see your family with you, you see things going well, that you start imagining yourself doing better. and avoid doing things and duties that aggravate your back. Of course, bending, twisting, lifting, scrubbing, pushing, pulling, things that aggravate your back, you're going to want to stop those things. And many of you will be shocked to discover that many of the things that your medical doctor told you to do, like rest in bed, that's a good idea, or use heat, use a heating pad, or take some anti-inflammatories, that they're actually making your back worse, your condition worse. So stop doing those things right away. They only provide temporary relief at best, and just because they feel good, it doesn't mean it's the right thing for you. And you can actually create balance inside of yourself, and there's systems where sick cells will be replaced with healthy cells. You could set it up to win, and I'll show you exactly how to do that today. If you're just responding to this webinar and tuning in late, on letting people know that they can win back their health naturally. And a few of you, by the way, will continue to suffer. I'll let you know that too. I'm going to surprise you today. I'll let you know what doctors know almost instantly about patients. They size them up. Did you know your doctor sizes you up? And he decides early on if you're going to get well or not. And almost every patient that comes to me does better. But the few who stay the same or get worse, I'll let you know what categorizes this kind of patient. They continue to look for answers. They continue to look for answers outside of themselves. And they think the answer is outside of themselves. I know that all healing, does this sound logical? That all healing comes from within, that it's always an inside job. And those crazy people, those poor souls who spend endless hours doing what they consider to be good research on the internet, for example, and they'll look on the internet for the secrets of fixing their back, and they'll look for all kinds of gimmicks, and they'll start another program, and they'll start another exercise, and they ask their neighbors. And the ones who keep reading more and more articles and buy another book and go see another doctor and buy another gimmick and get more therapy, a lot of them delay care so long that their problems become permanent. It could become permanent in nature. So stop looking around and cut it out. You're finding out ways to help yourself. And you may have had the condition so long that you're sick and tired. Are you sick and tired of feeling sick and tired? Perhaps you're angry. Perhaps you're frustrated by it all. And maybe you've been to physical therapy and had heat and needles and cold and injections, and you've rested and you had muscle stimulation and you had all the gimmicks, and you're just not getting anywhere. And you're looking for something different. I have something different to offer you. I've helped thousands and thousands with a natural approach that reestablishes the normal balance within so that your body can heal and you can have a full, active life again and get back to golf and get back to bowling and sports and motorcycling and back to lifting and tennis and all the stuff you love to do. But you got to stop looking around and start doing some right things. And you might be wondering, how? How do I do this, Dr. V? And you might be asking yourself, well, how do I do this? Or how could I start doing something as quickly as possible right now to help myself? And if you realize that the ideas that you were working with in the past haven't helped you or haven't been effective, have you tried some things in the past and they haven't worked? I'll tell you how to get going as quickly as possible. Would you like that? What I recommend right now is that you get out a pen or pencil and something to write on. And I'm about to offer some of you, obviously I can't accommodate everyone on the call, a free examination, but I'll check you out personally. And if you call now, 303-394-2273, write this number down. You may encounter busy phone lines, You get a free professional spinal analysis. We'll find out why you hurt. It's not normal for your back to hurt. We'll do a thorough history and find out exactly why you're hurting that way. Back pain is never normal, and there must be a reason why you're hurting. Let's check it out together. I'll invite you to a special event later on that you and your family can attend to be and stay healthy over a lifetime without drugs and without surgery. There's a time and place for everything, but we're drugged too much. We take too many pills, and there is a natural way to get well and stay well. And part of the program that I recommend utilizes a therapeutic massage table. You could check it out for free if you give this number a call. The diagnosis is free. X-rays and adjustments are not included. Adjustments mean realigning the spine, and that's not included. I'm located in East Denver, but many of you have had X-rays elsewhere. Bring your X-rays with you if you have recent X-rays, and insurance pays for X-rays and adjustments. So call 303-394-2273, but only call if you're serious about finding out what's wrong and maybe doing something about it. You could feel great, you could feel wonderful, but if you delay care, your problems may get worse and you might require drugs and surgery. Here's a local patient. His name is Preston Odie. He might be your attorney. He's a wonderful man. He does a heck of a job. He's an incredible attorney, and this is what he wrote about me. He says, Dr. V, that's my name. My name is Dr. Visentin. He says, Dr. Visentin is a healer. He has helped me correct an improper curvature of my neck and virtually eliminated my back pain from a bulging spinal disc, all created by years of hunching over a computer all day long, working at my desk, he wrote. So we helped Preston, and there's a good chance we could help you too. I'd love to accommodate all of you, of course, but realistically, I can't. So you might want to write this number down. We've got some work to do. I have a wonderful program that can help you. I'll give you that number again. It's 303-394-2273. We may not be able to get you in this week, and we may not be able to accommodate all of you. We can only accommodate the first 7 callers. So if you're serious about finding out what's wrong and maybe doing something about it, go ahead, give that number a call, 303-394-2273. There's operators standing by. I've really enjoyed working with you, telling you how you can help yourself. You can do some wonderful things and do better and feel better and get well naturally. My name is Dr. Visentin. 303-394-2273. You made the first webinar. It's been great. It's been a lot of fun. I've enjoyed talking with you. Now it's time to get busy and do the things you know you should be doing to help yourselves.